Okay, so we're gonna start with our Mitchell screening. So I'm gonna get you to stand up and just walk to the other wall and walk towards me just at a normal pace. Perfect, and walk back. And I'm gonna get you to do that again. I'm just gonna step to the other side of the room and go ahead and walk. Good, and walk back. Okay, and you can come back and stand over here. I'm just gonna get you to face towards me. I'm just gonna check posture now. So just hands up normally, as you normally stand. An elevated shoulder on your right side. Just gonna touch your hips if that's okay. Right. Now I'm gonna get you to face that wall. Perfect, and then face away from me towards the window. Great, yeah, that shoulder's a bit elevated. And then face the opposite wall. Perfect, and you can face towards me again. So next thing we're gonna do is I'm just gonna get you to cross your hands across your chest here. And then I'm gonna get you to bend to either side. As far as you can. Great, and then stand up straight into the opposite side. Awesome, you can let your hands go, and just same as what I'm doing, just reach down towards the floor, keeping your knees straight. Excellent. And then I'm just gonna get you to rotate your arms in the circumduction. We're gonna go twice forward and twice back. Great, and then go twice forward. And we'll do your other shoulder. And forward. A little bit of restriction there as well. All right, so I'm just gonna get you to put your hands on your hip for me. You should have enough space, you might have to rotate. And just pick up your knee and rotate it backwards. You can rotate your whole body if you need to as well. Great, and then step forward with that as well. Bring it back forward. And then do the other side. Great, and forward. Perfect. You can take a seat facing this wall. I'm gonna grab a stool for your feet. Place down. Awesome. And you're gonna flex down again and just sort of reach the floor, just bending at the hips. Great. And then I'm gonna get you to cross your hands again, and I'm gonna get you to rotate your hips to either side. Right, and the other side. And then keep your hands like that, and then just flex to either side. Perfect. And other side. Great. And then you can drop your hands down, and just a couple neck movements. I'm gonna get you to rotate one side to the other. Perfect, and to the other side. And then I'm gonna get you to drop your ear to your shoulder, and other ear to your shoulder. Great. And I'm gonna get you to sort of look down at an angle towards your armpits. Other side. And then flex your head as far forward as you can, and then extend it as back as you can. I'm gonna get you to flex forward one more time. Perfect. You can lay down, face up. Yep, head down that way. And just, I'm gonna just put your hands by your side. Just gonna look at your breathing here. So I'm just gonna hold on. Just take a couple of normal breaths for me. Side. Perfect, and as you're laying here, I'm just gonna check and see if there's any difference. I'm just gonna tap a few times on your bones here. Anything feel unordinary?
Nope.
No. Something on this side. Anything unordinary? No. Just top of the knee here. Unordinary at all? Anything unordinary? No. Drop down here. Anything? Anything? No. Anything there? Anything there? No. of your ankles. Anything there? Ooh, fifth metatarsal. Anything there? Nothing? And anything there. And then last one, I'm gonna get you to flip over onto your front. So I'm just gonna find your ischial tuberosity, it's called. I'm just gonna give that a tap there. Anything? And anything? No. Perfect. And just as you're laying down, you can rest your chin on your arms if you'd like. So stack everything. So I'm just gonna do a thermal scan. See if there's anything that feels warm. Go to the side as well. All right, I can get you to sit again. I'm just gonna get you to put 2 of these underneath your armpits for a few minutes and on the other side as well. And just as you're sitting there, I'm gonna check your pulse. About 70 beats per minute. And then I've had you laying down. I should have checked. Did you ever notice any varicose veins or anything on the back of your legs at all? No? I'm gonna check your lower back. Just lift up your shirt if you don't mind. Perfect. Nothing there that I noticed. We'll just give those another moment. I can grab this from you now, actually. No difference. They're still about the same. Let's toss those. So I'm just gonna do some more testing. So I'm gonna get you to stand up and face the window for me. And just with your head neutral and straight, arms are relaxed. Just gonna make some notes as I go as well. Bit of a lumbar rotation from about L1 to L4. Also a slight side bend, both to the right. Just gonna make a note of that. Both to the right. Perfect. I'm just gonna check your hip heights here. Those are even. I'm just gonna get you to cross your arms in front of you. Those are even. I'm just gonna get you to turn this way for me for a moment, just so I can get in here. Perfect. And you can move the other way. That is even. I'm just gonna get you to bend forward. You can relax your arms and just bend forward for me. Perfect. You can stand up straight. Those stand even. Perfect. I'm going to get you to actually flex your head forward now. That side bend does correct when your head is forward. Rotation is still slightly there. It's not. as bad. I'm gonna get you to extend your head back for me now. Side bend does correct an extension as well. Rotation is still there. Rotation is up a bit further in your thoracic area. Okay, perfect. You can put your head back into neutral. I'm going to get you to sit here again. Knees to the back. I'm going to get you to rest your feet on this stool. So same thing, head in neutral, and I'm just going to run my fingers down your back again. The side bend is still there in the lumbar. Rotation corrects itself while you're seated. I'm going to get you to flex your head for me. Perfect. There's no change, and extend your head back. Turns with extension, but it's not as prominent as it is when you're neutral. Perfect. You put your head back. I'm just going to check your hip heights while you're seated here. Those are still even. Check your what's called your deep sulcus. Those are even. I'm just going to place my fingers here, and I'm going to get you to bend forward again. Right at the hips. Perfect. There's no change there. Great, I'm gonna get you to lay face down for me. You can stack your chin on your elbows. Great. Everything that I'm finding seems to be in a neutral position. I'm going to get you to come up onto your elbows. Check that again. Perfect. You can relax down again, just so everything's stacked. I'm just gonna reach and touch your hips just to see how much they're pushing into the table. Is that okay with you? No difference on either side. I'm going to check this. I'm gonna get you to come up onto your elbows there again. And down. And I'm going to touch your sacrum and your coccyx. Is that okay with you? Just to see how they are. Your sacrum looks level. And now down to your coccyx. Also seems level. Alright, just going to press up to here. DILAs are even. I'm going to get you to come up onto your elbows one more time. Perfect, and there's no change. Great, I'm going to get you to flip over to your back, please. I'm going to grab my measuring tape here. All right, so I'm just going to get you to palpate your pelvic tubercle for me. Just the bony area on the top. Should be right down a little bit lower, right about here. Perfect. Do you mind if I put my hand there?
Sure.
Right about there. Perfect. You can move your fingers there. Find your hip bone as well. Consistent on either side, you're about 9. you don't mind, I'm just gonna come back to your pelvic tubercle. Can I palpate that again? And that is even. Perfect. All right, so I'm gonna do some range of motion testing on you now. So I'm just gonna find what's called your feather barrier. So I'm just gonna move you in a couple different positions. If anything feels uncomfortable, let me know. I'm just gonna bend your knee here. I'm gonna go into flexion. All right, as we're here, I'm gonna bring you into rotation. You into what's called a figure 4. So just drop your knee there. Great. Just a little bit of pressure. Perfect. Drop that down. I have to do the other side here. Flex your knee as well. There. I'm going to rotate you again. It's there. And back the other way. A bit more resistance on that. Perfect. I'm just going to get you to actively flex your ankles into plantar flexion and dorsiflexion, just about 5 times. Ankles there, perfect. And plantar, up. Any pain or anything with that?
Nope.
No. Perfect. I'm just going to take one leg at a time and pull them outwards. There, I'm going to bring it in. Resistance going in that way. Same thing on this side. More range of motion on this side. There. Bring it back and then go inwards. Some resistance there. Perfect. I'm going to get you to flip over onto your stomach for me. All right. I'm just going to bring up and check the flexion of your knee. Just relax for me. This one. Perfect. So we're going to go into the treatment to correct that lumbar right side bend and the rotation that you have. So the first thing we're going to start with is called a global osteopathic assessment or treatment. So I'm going to get you to lay onto your back. And for these, I don't want you to help me, so I'm going to grab each side, each hip, and I'm going to rotate it counterclockwise and clockwise, okay? So just relax, don't help. Over and do the other side. Any pain with that at all?
Nope.
No. bad at all?
Nope.
All right. So now I'm just gonna drop your legs. I'm gonna bench you up here. And I don't want you to help me. Same thing on the other side. Any pain with that? No. Any pain with that? So I'm just gonna mobilize here. So what I'm gonna get you to do is I'm gonna get you to roll towards me with your whole body. And relax. And just about 10% effort. We'll just go a little lighter next time. And same thing. That's good. Great. Relax. Now I'm going to get you to roll away from me. I'm just going to sort of cup my fingers into here and roll away. That's good. And relax. And one more time. Perfect. And we'll do the other side. So I'm going to get you to roll away from me. Perfect. And relax. And again, roll away from me. And relax. And I'm going to get you to roll towards me. Perfect. And you can relax there. And one more time. And you can relax. So I'm just going to check you. I want you to stand up with your head straight forward. I'm just going to double check and see if that may have corrected that lumbar. Great. Still have a slight side bend. You still have a right rotation in that area. Perfect. I'm going to get you to lay back down on the table. We're going to do something that's called a muscle energy technique. This is more of a local treatment. So first thing I'm going to get you to do is same sort of things I did before. So I'm going to put you up here. And then using 10% of your effort, so it's not very much, I'm going to get you to bring your hip or your knee towards your head. And I'm going to resist it here. There we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. And again, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. And resist. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. We're gonna do your knee here. So I'm gonna get you to push into my hand. So with your knee, so flex your knee. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. And again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And relax. And one more time. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And relax. I'm gonna come around and do this side. All right, and push into my hands. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. And again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And relax. And then again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And relax. Do your flex knee. So I'm going to get you to push down. 1, 2, 3, 4, 5, 6, 10, and relax. 2 more times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. And down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. So I'm just going to rotate you here. And I'm going to get you to resist. I'm going to resist this way. Perfect. Yeah. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. towards your midline. 1, 2, 3, 4, 5, 6, 8, 9, 10. Relax. And again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And relax. And again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Do that on the other side here. And you're going to push outwards. Yep. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And relax. And again. 2, 3, 4, 6, 7, 8, 9, 10. And relax. And again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And relax. And bring it this way a little bit. And you're going to push it in towards yourself. 10 and relax. And again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 and relax. And again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 and relax. Any pain or anything with those?
No.
No. Now I'm going to place my hands right here, and I want you to squeeze your knees and your thighs together. 10% effort. 2, 3, 4, 5, 6, 7, 8, 9, 10. You can relax and do it again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And relax. And again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Perfect. We're going to do those again. I'm just going to drop my fist down to your ankles and squeeze. 1, 2, 4, 5, 6, 7, 8, 9, 10, and relax. And squeeze again, about 10%. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And relax. And again. 3, 4, 6, 7, 8, 10. And relax. So now we're going to go on the outside. And we're going to get you to push out with 10% of your effort again. And go ahead. 3, 4, 5, 6, 7, 8, 9, 10. And relax. And again. 1 last time. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Perfect, and relax. So I want you to bring your feet up to your head. I'm just going to resist there. Perfect. And then we just do it one time with your feet pointing to the wall. 6, 7, 8, 9, 10. Perfect. I'll get you to pump your ankles one more time, about 3 times each. Perfect. Great. I'm going to get you to flip over onto your stomach again. We just have 2 more resisted techniques to do. So I'm going to bend this knee. All right. I want you to bring that up to your butt. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Again. 2, 3, 4, 5, 6, 7, 8, 9, 10. And relax. And one last time on this leg. 3, 4, 5, 6, 7, 8, 9, 10. Perfect. I'm going to resist your hip. Just relax your hip extension here. All right, so I'm going to get you to bring your leg up. I'm going to resist it. Go ahead. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And relax. And one last time. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And relax. And again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And relax. This one. And bring that up towards your head. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. 2 more times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Perfect. And one last time. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Great. get you to bring your back of your leg up to the ceiling. Perfect. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And relax. And last time. 2, 3, 4, 5, 6, 7, 8, 9, 10. And relax. All right. How are you feeling?
Good.
Good. I'm going to get you to stand up again so I can check to see how that lower back is doing. That's perfect right there. Keep your head neutral. Adjust your shirt. Side bend is getting better, but it is slightly there. Your rotation is better, but it's still slightly there. So the last thing I'm going to do is a very local technique. So I'm going to get you to sit onto the table again. So I'm going to do a correction just specifically on the L1 to L4 area. You can put your feet on there. So everything is moving to the right. So you have that side bend to the right and the rotation to the right. So I'm going to come onto your left side here. I'm going to find that area. Pressure. So with this, I'm going to move you in the opposite direction. So since it's to the right, I'm going to get you to side bend to the left for me. So just towards me here. That's great. And then I'm going to get you to rotate a little bit to the left as well. Perfect. I can feel that movement. So now I'm going to hold this for about 10 seconds and I want you to straighten up. Then I'm going to resist that. Perfect. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Perfect. And I'm going to check you again, so I'm going to get you to stand up. Let's see how that's looking. We are so close. I do just want to do that one last time, so I'll get you to sit. I did want to check you though, just so we don't overcorrect. All right, so same thing, I'm gonna find that area. There. Come towards me and rotate, excellent. And try to straighten up again. 2, 3, 4, 5, 6, 7, 8, 9, 10, perfect. And you can stand up. Let's check that and hopefully we got it. Your side bend is straight, it is no longer there. And your rotation, you are looking even. Perfect. So like I said before, you might be a little sore just with how we corrected things, but I'll call you in the next couple days to make sure that you're feeling good. Perfect. And I do want to see you back in about a week and we'll reassess. Thank you.